Jeanne Faulkner, Common Sense Pregnancy, Navigating a Healthy Pregnancy and Birth for Mother and Baby. Pregnancy can be an overwhelming experience, with countless questions and concerns coming to mind. Common Sense Pregnancy, by Jeanne Faulkner, offers guidance and practical tips to help you navigate your way toward a healthy pregnancy and birth for both you and your baby. Key topics covered in the book include finding the right healthcare provider, understanding the different stages of the pregnancy process, proper prenatal care and diet, recognizing when to call your doctor, and identifying the differences between labor and pre-labor. The book is designed to ease your worries and guide you through complex issues in user-friendly language.
Navigating early pregnancy. When you discover you're pregnant, it's common to feel overwhelmed. Resist the urge to rush to your doctor, as appointments are typically scheduled for the 6 to 8 week mark. Use this time to choose a suitable healthcare specialist, start taking prenatal vitamins, and monitor potential signs of complications like severe nausea or vaginal bleeding. If any concerning symptoms occur, don't hesitate to contact a medical professional. As you embark on this incredible journey of pregnancy, remember there's no need to panic upon receiving the news. While your first instinct may be to contact your doctor, it's normal for them to schedule your initial appointment 6 to 8 weeks after conception. In the meantime, focus on taking positive steps to ensure a healthy pregnancy. While it's too early for medical tests like ultrasounds, make sure to begin taking prenatal vitamins. These supplements provide essential nutrients like folic acid and iron, crucial for this early stage. Additionally, start researching and selecting a reliable healthcare professional to be by your side throughout your pregnancy. Comfort and trust should be the key factors in your choice. Though it's essential to stay relaxed, be aware of important symptoms that could signal complications. Bleeding or severe nausea should never be ignored. Hyperemesis gravidarum, an extreme form of nausea, may require medication and rehydration under a doctor's care. Likewise, vaginal bleeding or spotting can occur in up to 25% of pregnant women during the first trimester. If the spotting persists, increases in intensity, or you're unsure about its severity, contact your doctor, as these could indicate a miscarriage. Your medical professional will advise you on the appropriate next steps to ensure a safe and healthy pregnancy. With these guidelines in mind, you'll be better equipped to navigate the early stages of pregnancy and help pave the way for a smooth and enjoyable experience over the next 9 months. Midwife versus obstetrician. When preparing for childbirth, most women opt for an obstetrician, but midwives may be the better choice for those expecting a normal pregnancy. With personalized care and a lower risk of complications, midwives offer an alternative to the more prevalent obstetrician model. Another option is to find a qualified doula to support you through labor, but always do thorough research to ensure their expertise. While planning a hospital birth, you may envision the room filled with familiar faces, but often it's populated by on-call doctors and nurses. To make the experience more comfortable, consider hiring a personal support team. Midwives may be a better option for most pregnancies, as obstetricians typically specialize in high-risk or complicated cases. Choosing a midwife you trust provides more personalized care and attention. Midwives are equipped to handle all aspects of childbirth, from avoiding C-sections to addressing any injuries or trauma. They're also trained to recognize situations where an obstetrician's intervention may be necessary. In fact, a 2013 study by gynecologist Nancy S. Roberts revealed that the midwife model, popular in Europe, had fewer risks, illnesses, and fatalities for both mother and baby compared to the United States' ubiquitous obstetrician model. Another choice for expecting mothers is to enlist the support of a doula. Doulas specialize in childbirth and can provide invaluable assistance during labor. However, be diligent when selecting a doula, as there are no standardized regulations for certification, which can result in varying qualifications. It's crucial to research their background thoroughly to ensure they're prepared to help. When choosing a doula, prioritize finding one who understands hospital procedures during labor. This familiarity can prevent disputes with hospital staff amid labor pains, making for a smoother childbirth experience. In either case, whether opting for a midwife or a doula, consider the benefits of having a personalized support system to guide you through the journey of welcoming your baby into the world. Navigating pregnancy nutrition. Pregnancy nutrition has drastically changed over the last 50 years. Previously, pregnant women experienced less weight gain due to healthier diets with fewer preservatives, chemicals, and smaller portions. The introduction of high-fructose corn syrup has contributed to increased calorie consumption, leading to weight gain during pregnancy and risks for both mother and child. Current recommendations aim to guide pregnant women towards a balanced diet, avoiding harmful foods and incorporating essential vitamins and nutrients. In the past, pregnant women were rarely given specific guidelines on what to eat. Their diets generally consisted of healthier options and smaller portions, thus minimizing the risk of excessive weight gain. One notable factor was the absence of high-fructose corn syrup, a substance that today adds copious amounts of calories to everyday foods. Additionally, earlier diets contained fewer artificial ingredients, chemicals, and preservatives. Expecting mothers in the 1950s and 1960s usually gained no more than 30 pounds during pregnancy, and doctors would discourage them from gaining more. While this may seem unkind by today's standards, it helped prevent the significant weight gain, up to 80 pounds, often seen in modern pregnancies. Such excess weight can negatively impact both mother and baby's health. With these issues in mind, detailed dietary guidelines have been developed to support the well-being of pregnant women. These recommendations may seem intricate, but adherence to them can ensure optimal nutrition for both mother and baby. A crucial aspect of following pregnancy diets involves avoiding specific items that pose potential harm, such as soft cheeses, raw animal products, and unpasteurized beverages. These foods may harbor dangerous bacteria and toxins. Moreover, a balanced diet should include foods rich in vitamins and nutrients essential for maternal health. A variety of fruits and vegetables, whole grains, lean proteins, and calcium-rich options like milk, leafy greens, and tofu should be present in every meal. These elements nourish the mother and promote healthy fetal development. Amniotic fluid mysteries. Akin to a fish needing water, a fetus requires sufficient amniotic fluid in the womb for survival, which is regularly monitored during pregnancy checkups. Two rare conditions may occur: polyhydramnios, marked by excess fluid, and oligohydramnios, where there is too little fluid. Polyhydramnios affects just 1% of pregnancies and often resolves itself, but can sometimes lead to complications like premature birth or stillbirth. The causes remain uncertain, with theories revolving around infections or health issues interfering with fetal swallowing, or maternal diabetes. Oligohydramnios, affecting 4% of pregnant women, can also have severe consequences, including miscarriage, still or premature births, and restricted blood flow to the baby. Mothers should be attentive to signs like fluid leakage and lack of weight gain, seeking advice from their doctor on amniotic fluid levels if needed. Rethinking induced labor. The prospect of labor can be both exciting and daunting for expectant mothers. As discomfort grows during the final weeks of pregnancy, many women opt for induced labor, a procedure that has become increasingly popular since the 1990s. However, induced labor should ideally be reserved for emergencies, as it often leads to C-sections, which carry a higher risk of injury or death. One valid reason for induced labor is dangerously high blood pressure in the mother, which can cause complications for both mother and child. In such cases, induced labor is the safer option for both. During the final weeks of pregnancy, expectant mothers often experience intense discomfort as their bodies endure cramps, aches, and swelling. As a result, induced labor has gained popularity over the years, with the number of cases rising from 9.5% in 1990 to 23.3% in 2012, according to obstetricians Osterman and Martin. However, the overprescription of artificial labor induction overlooks its potential consequences. While natural labor prepares a mother's body for birth, artificially induced labor can lead to C-sections, which carry an increased risk of injury and even death. Inductions should therefore be limited to emergency situations and instances where the health of the mother or child is in danger. One such circumstance arises when the mother's blood pressure reaches dangerously high levels. Dutch gynecologist Corine Koopmans asserts that elevated blood pressure can weaken a mother's organs, particularly the kidneys, jeopardizing the health of both mother and child. In these cases, induced labor is a safer option for all involved. Decoding pre-labor and labor. There's no foolproof way to prepare for the complexities of labor and childbirth, but understanding the difference between pre-labor and actual labor can be crucial. Pre-labor pains might occur a week or more before your due date and can feel extremely intense. However, these contractions generally serve to position the baby optimally in the pelvis. If you can still breathe, speak, and move without severe limitations, chances are you're not in true labor yet. One technique to differentiate pre-labor from labor is to relax in a hot tub or take a gentle walk. If contractions become irregular or ease up, it's likely pre-labor. When genuine labor starts, the pain will sharply intensify, accompanied by contractions occurring every 2 or 3 minutes with minimal breaks. That's when it's time to head to the hospital. Breathing techniques for labor. Proper breathing techniques can significantly help manage labor pain. One popular method is the Lamaze breathing technique, which involves inhaling and exhaling twice while making hee-hee and hoo-hoo sounds. It is crucial to practice these techniques throughout pregnancy for maximum benefit during childbirth. Another method to ease labor pains is using a warm bath, which relaxes the body and provides pain relief. Many hospitals offer water birth options, so researching available facilities can help ensure a more comfortable birthing experience. Breathing plays a vital role in managing labor pain, and mastering specific techniques can significantly aid in the process. The well-known Lamaze method, often seen in movies and television, is a valuable technique to employ during labor. This approach requires inhaling twice, making hee-hee sounds, and then exhaling twice, producing hoo-hoo sounds. However, any form of deep, rhythmic breathing can also be beneficial during labor. Focusing on breathing diverts attention from pain, relaxes the mind, increases oxygen flow, and provides a surge of energy. To fully optimize these techniques during childbirth, practicing throughout pregnancy is essential. Consistent practice can enable breathing techniques to effectively support dilation and cope with the pain and excitement of labor, despite potential distractions. In addition to breathing exercises, using a hot bath is another method to alleviate labor pains. Submerging the body in warm water promotes relaxation and pain relief. Ideally, the water level should cover the entire belly, or a towel can be used to keep the exposed area warm if necessary. Modern hospitals recognize the benefits of water during childbirth and often provide water birth options, such as tubs, jacuzzis, or inflatable pools. Researching hospitals that offer these facilities can help expecting mothers choose the most suitable and comforting method for their birthing experience. Postpartum Survival Guide. The post-childbirth period comes with several challenges, including physical discomforts such as cramps, bleeding, and soreness. Feeding your child may involve swollen breasts and cracked skin, and sleepless nights tend to be the norm. To ease some of the pain, try warm baths, ice pads, and pain relief medication when necessary, all while keeping in touch with your healthcare provider. While challenging, the joys of holding your child make it all worthwhile. Experiencing childbirth is a uniquely intense journey, but don't expect relaxation after the baby arrives. The first 6 weeks postpartum can be riddled with physical hurdles and discomforts, like cramps, bleeding, lower abdomen and vaginal soreness. Feeding your baby can be demanding, as breastfeeding can involve swelling and leakage from tender, dry, and cracked breasts. Sleep deprivation also becomes a reality. Grabbing a mere 2 hours of rest before your little one needs attention and sustenance is a valid accomplishment. But take heart, for there are ways to manage these post-birth challenges. Postpartum pain, particularly following a vaginal delivery, can be relieved through warm baths as they effectively soothe common swelling and soreness. Additionally, freezing large hygiene pads soaked in water yields ice pads that can be placed in your underwear for about 15 minutes a couple of times each day, providing much-needed cooling comfort. Pain relief medications such as ibuprofen, Vicodin, and lidocaine may be useful for strong pain, especially post-C-section, but maintain contact with your healthcare provider to avoid potential dependency. Remember to follow their advice regarding prescription medications. In essence, the post-childbirth experience is undoubtedly demanding and painful, but rest assured that it's not in vain. The unparalleled joy of cradling your child will reaffirm that every challenge you face during the postpartum period is entirely worth it.
Pregnancy is a unique journey filled with joy, anticipation, and its fair share of challenges. Common Sense Pregnancy equips you with vital information and practical advice to ensure the healthiest possible path for both mother and baby. Through understanding prenatal care, recognizing alarming symptoms, seeking the right healthcare provider, and keeping a nutritious diet, you can make the most out of your pregnancy experience. Remember, it's essential to utilize this newfound knowledge, listen to your body, and communicate with your chosen specialist to make the next 9 months a rewarding and memorable experience.